Welcome to my channel Deep Learning Biology. My name is Dr. Vikas Bhardwaj. In this video, we are going to have discussion related to nightmare bacteria. Hopefully, you must have heard the news. In USA, there is sudden rise in number of cases of nightmare bacteria infection. So today in this video we are going to have some discussion related to nightmare bacteria. Now here I just want to tell you, if you see the CDC reports, Center for Disease Control and Prevention reports, what they are saying that there is sudden rise in number of nightmare bacteria infection, and if you see in past few years there is 70% increase in number of nightmare bacteria infections. So here, hopefully you must be knowing about superbugs. Here I just want to tell you, superbugs, they are multi-drug resistant bacteria. Superbugs are multi-drug resistant bacteria, and nightmare bacteria, these bacteria, they are also resistant to most of the drugs. And here generally these bacteria are resistant to carbapenems. So keep in mind, nightmare bacteria, these are carbapenems resistant bacteria. Yes, here you are going to see bacteria like Klebsiella, you are going to have Klebsiella pneumonia, E. coli, and keep in mind these bacteria, nightmare bacteria, they include group of bacteria which are resistant to the drug carbapenems. Now here I just want to tell you what is carbapenems. Now here if you see this drug carbapenems, here this drug is actually the last choice, you can say last resort antibiotics which doctors are going to prescribe to a patient if any other drug is not going to work. So here you can think that this is the last resort antibiotics the doctors are going to use if someone is going to have bacterial infection. If other drugs are not working, then doctor finally they are going to use carbapenems. Okay, but try to think here, if these bacteria number is going to increase, these nightmare bacteria number, then what will be the situation? These nightmare bacteria, they are actually resistant to carbapenems. Even the carbapenems drug is not going to work. Yes, here I just want to tell you that these bacteria, nightmare bacteria, generally they cause infection like other bacteria, and generally they are going to infect lungs, blood and the urinary tract. But here keep in mind, these bacteria, nightmare bacteria, they are very hard to treat. We are not going to have any treatment. So this is a very serious concern. Now try to see here in USA there is increase in 5-fold number of cases of nightmare bacteria. This is very alarming situation. Now let us discuss why there is increase in number of cases of nightmare bacteria in USA. So there are few reasons. One reason, okay, is that due to antibiotic overuse. Okay, the people there, they are using antibiotics, okay, and if they are going to use excessively, okay, so these bacteria, okay, they also learn how to survive in difficult situation. So these bacteria, they carry drug resistant genes and they can share the drug resistant gene to other bacteria. So one reason is antibiotic overuse. Okay, sometimes the people, they are going to use antibiotics not in consultation with the doctor. That is also going to that is also the reason. Okay, so sometimes people, they are going to take drug, and if they are not going to complete the treatment, okay, then that situation can also lead to increase in number of nightmare bacteria. Yes, here if you see, the another reason is hospital spread. So most of the times the patient who are in hospital, if they are going any kind of treatment, and if they are going to use, they are taking drugs, okay, they are having some kind of treatment, even in those patients also you are going to have, you can see the infection of nightmare bacteria. Try to see generally in patients who are going to have weak immune system, and they are going to have treatments of other disease. Okay, so in that situations also you can see that patient may suffer from nightmare bacteria. Now here if you see, after COVID-19, okay, post-pandemic vulnerabilities also are responsible for the increase in nightmare bacteria infection. So after COVID-19, nowadays you see the people, they are staying for a longer time within the hospitals, okay, and yes, most of the times they are taking a heavy dose of antibiotics. Okay, this long stay and excessive use of antibiotics, okay, is also leading to 5-fold increase in nightmare bacteria infection in USA. So these are some of the reasons. Now here if you see the nightmare bacteria, okay, now these nightmare bacteria, they are going to have very high mortality rate. Okay, these nightmare bacteria, they are going to have high mortality rate, means if they are going to infect individuals, so 50% of the individuals, they are going to die. Okay, so here if you see, the mortality rate is 50%, and generally I have told you they are going to cause infection in blood, lungs, urinary tract. Okay, and these bacteria, as we don't have treatments, we are having very limited treatment, even that, okay, carbapenem, the final drug, okay, now these bacteria, they are resistant to that drug carbapenems. Okay, so they can create a fatal situation easily. So keep in mind, these bacteria, they are having a very high mortality rate. Yes, some of the individuals, okay, they can act like silent spreaders. So in some individuals, you are not going to see any symptoms of the disease, but these individuals, okay, they will act like a carrier, and they will pass these nightmare bacteria to other individuals. Okay, so there are individuals, silent spreaders also. Okay, that is also one reason that there is increase in number of nightmare bacteria infections. Now here if you see these nightmare bacteria, I have told you they are resistant to carbapenems. Now here this drug carbapenems, actually what it does, it actually inhibits the cell wall synthesis in these bacteria. So this drug carbapenems, okay, it is going to inhibit the cell wall synthesis. So bacteria generally, they are going to have outer cell wall. This is a protective covering of the bacteria, and if we are going to inhibit the synthesis of cell wall, means bacteria, they are going to divide, they need a cell wall. Okay, and if that is not being synthesized, so what is going to happen? The bacteria is not going to survive. Now these nightmare bacteria, they actually have one gene. The name of the gene is NDM gene. NDM gene. Okay, this is New Delhi metallo-beta-lactamase gene. New Delhi is capital of India. Okay, so New Delhi metallo-beta-lactamase gene. So due to the presence of this gene in nightmare bacteria, what is going to happen? These nightmare bacteria, now they can neutralize the drug carbapenems, the last drug. Okay, they can neutralize even this drug also. Okay, so hopefully you are getting the situation. Okay, try to see here. If you see that the bacteria, okay, if you are going to put the bacteria in the presence of this drug carbapenems, what it will do? It will inhibit the synthesis of cell wall. Now the bacteria, these bacteria, okay, nightmare bacteria, they carry a gene, NMD gene. Now this gene is going to code for one enzyme. Okay, this enzyme will neutralize the drug. Okay, this will neutralize the drug, and what will happen? There will be no effect of the drug on the bacteria. Bacteria will survive and it will pass the infection to lungs, okay, and to urinary tract, okay, and to other organs. Okay, so this is about this carbapenems. Okay, now here I have told you that now these bacteria, they are becoming, okay, resistant. Okay, so in that situation, even the last drug, that is not going to kill the bacteria. So these group of bacteria, they are going to survive and they will cause the infection. So here, hopefully you have also seen the news that in USA, if you see in last 5 years, there is five-fold increase in infection due to nightmare bacteria. Now here, if you see, I have told you these nightmare bacteria, they carry a gene, NDM gene. Now this gene, okay, they are spreading to other bacteria. Now try to think, okay, if other bacteria, okay, they will also carry this gene, they will also become drug resistant. Okay, so this is going to create a difficult situation. Okay, so here remember these bacteria, they also communicate. So we are discovering antibiotic, we are inventing antibiotics. Okay, and what these bacteria are also learning, they are also learning how to survive in difficult situations. They are also passing the message, they also carry the genes, okay, which they share with other bacteria. So this way you see there is a spread of NMD genes in bacteria, and this is going to give rise to increase in number of nightmare bacteria. Now here, if you see the data from 2019 to 2023, okay, from 29 states of America, what you are going to see that something like 4,300 cases of patients who suffered from nightmare bacteria infection. And here if you see, out of these cases, 1831, okay, in 1831 cases, the scientists, doctors, they found that the bacteria, they were carrying this gene, NDM gene. Okay, so this is one information. And here keep in mind that these bacteria, they are very hard to treat. They are very hard to treat. Even the last drug which we have, that is not going to work. So this is one alarming situation. Now here, what precautions we must take so that we can stay safe? Okay, that is important. Now try to see here, the first thing, practice good hand hygiene. This is the most important thing. Practice good hand hygiene. If you are going to visit, if someone is going to visit any hospital, okay, after visiting the hospital, wash your hand, okay, properly. So because most of the times these bacteria, they are present in hospitals. Okay, so first thing, practice good hand hygiene. Second, use antibiotics properly. use antibiotics properly. Okay, yes, if doctor is going to prescribe some drugs, okay, sometimes individuals, they will take the drug for few days, then they are not going to take. Okay, this is going to give rise to a population of drug resistant bacteria. So please complete the course. Okay, that is also important. Third, okay, keep wound clean. Keep wound clean. Okay, if you are going to have some wound, okay, keep that wound clean, because through wound these bacteria, they can infect. Okay, that is, hopefully you understand, that is also important. Now the last point here, if you are going to travel to USA or even to other countries, okay, take extra vigilant. If you are traveling to hospitals, okay, then be vigilant. That is most important. Okay, take every precautions which you can take. Okay, so this is about the bacteria, okay, nightmare bacteria, and hopefully if you are going to have good hygiene, food safety, if you are going to maintain healthy conditions, you can protect yourself from this bacteria. Hopefully you have learned clearly about nightmare bacteria. We have discussed some basic information. Okay, thank you for watching this. Please do like, share the video, and subscribe to my channel Deep Learning Biology. Bye bye, take care, God bless you.